Coming up tonight, trade talks focus on strengthening solidarity within the MSG. Labour Ministry conducts workshop and Health Ministry to review 1965 Quarantine Act. Good evening, I'm Sandra Sam. Trade amongst MSG member states is an underlining concept aimed at enhancing economic relations in the region. The first series of the MSG official meetings began today in Suva as a lead-up to the Special Leaders Summit next week, where member MSG delegates will deliberate further on issues ranging from trade in services, legal institutional issues and border control.
The expansion of the MSG trade agreement beyond trade in goods to include trade in services and the movement of labour amongst Melanesian countries was initially endorsed by the MSG in 2005. Over the past 5 years, several services subcommittee meetings were held, with the first focusing on a services cooperation framework for MSG countries, which was developed by the Solomon Islands. In recognizing the growing importance of the labour skills as an integral contributor to national development, MSG member countries continue to explore measures to support the movement of skilled labour in Melanesian countries, similar to existing arrangements made for trade in services. This process will also contribute effectively to enhancing our economical and technical cooperation and also enable better understanding amongst Melanesian countries. For this special MSG summit, continuous dialogue and sharing of information and experiences is vital in ensuring that member MSG nations move forward as sovereign states in the Pacific region with a desire to further developing our unique and special Melanesian relations through culture, trade and human mobility schemes. With major corporate companies such as ExxonMobil of Papua New Guinea scheduled to begin gas refinery soon, other employment opportunities could also be explored within the MSG region as part of our capacity building and skill exchange program. However, today's meeting also looked at areas of improving trade amongst MSG countries, where officials also reviewed minutes of the last meeting held in Port Vila early this month, which also included the adoption of the ISCO 08 systems for quantifying occupation in the respective MSG states.
The meeting in Vila, at the same time, in considering the scheme that has been going on between Vanuatu and Solomon Islands, was able to receive a presentation from the Ministry of Health. There was a representative from the Ministry of Health in Vanuatu who provided a brief presentation on the scheme that has been going on between Vanuatu and Solomon Islands and what has been some lessons learned and how could these discussions on the MSG-SMS picked up on the successes and the failures that has been experienced by the Vanuatu recruitment of nurses from Solomons. Towards the end, the meeting had an opportunity to revisit the MOU, and there was a number of discussions that we had on revisiting the MOU, and members agreed that the following areas need to be revisited. That's A, quota. Since the meeting has agreed to an overall quota of 400 per country for the scheme would be amended, or if not, the schedule for each member country needs to be amended to remove the column on quotas. The structure of schedule, members agreed to have one schedule per country rather than a consolidated schedule. Members were agreed to have an individual schedule annexed to the MOU. So that has been taken care of by the Secretariat and is now before you with the documents on the schedule.
The Labour Ministry is currently conducting Phase 4 of its Permanent Impairment Evaluation workshop for medical assessors at the Holiday Inn in Suva today. The training is held on the Impairment Assessment Manual for OHS staff, National Occupational Health and Safety Advisory Board and staff of the Solicitor General. The training was opened by the Minister for Labour, Industrial Relations and Employment, Chone Usumate.
The training on Impairment Assessment Manual for Occupational Health and Safety, or OHS, is conducted by Dr. Dwight Doda, an expert and a renowned occupational medicine specialist and consultant from Australia. This is the fourth time the Labour Ministry has engaged Dr. Dauda to conduct such a training for doctors on impairment assessment for work-related injury or condition since 2006. This time around, the training is targeted to non-medical assessors who work with medical assessors at the claims processing level, legal counsels and board members. In Fiji, 40 doctors have already been trained as medical assessors on permanent impairment evaluation conducted between 2010 and 2011. While speaking to the participants this morning, Minister for Labour Mr. Usumate says it is vital for Fiji to develop its impairment manual because of the deficiencies in the 1965 Workmen's Compensation Manual and the need to maintain consistency in assessment by doctors, but also to be in par with the international communities around the region. This impairment assessment training is part of the overall Workmen's Compensation Reform, which is the last of the labour reforms the ministry has worked on from the early 1990s.
The Quarantine Act of 1965 is currently in the process of being reviewed by the Health Ministry. The current act focuses more on the threat of diseases and not on the public health risk. Health spokesperson Penny Namotu says the ministry also needs to increase the penalties given on the existing act.
With the increasing number of foreign vessels arriving into the country, there are numerous public health risks that need to be considered. The existing Quarantine Act will be reviewed with the focus to protect Fiji's citizens from health risk posed by visiting vessels. Ministry of Health spokesperson Penny Namotu says the current act was enacted in 1965 and is now outdated.
The new foreign diseases that has been emerging in other countries, which Fiji is one of the country as well that is exposed to these because we are engaged ourselves in trade practices. So at this point in time, we are working together with other stakeholders, for example, the Immigration Office, working with the shipping agencies. We're working also with the biosecurity in terms of reviewing the act and to see that it is up to par and also consistent with the international health regulations.
Mr. Namotu says the existing Quarantine Act will see a paradigm shift from disease-focused to public health risk-focused.
For example, when H1N1 and SARS came into our shores a couple of years ago, these are two diseases that are not provided in the existing Quarantine Act. And there was no mechanism in place to actually address or to see that these two diseases did not come into our shores. So we're looking at that. These are some of the loopholes that we see that needs to be addressed in the reviewing of that, and to see that not only that, it's up to par and also consistent with the international health regulations.
Namotu added that existing penalties in the Quarantine Act of 1965 is something that the review team will look into since these are outdated and the charges are minimal. The Health Ministry, together with other stakeholders, held a first round of consultations on the review of the Act last week. Namotu says similar consultations would be held in the Western and Northern Division before a submission is made to the Solicitor General's office and endorsement by Cabinet.
Coming up after the break, ensuring that MSG is aligned to changes, sugar talks to assist farmers, and labour reform to be reviewed by Cabinet.